Hi, everybody. I hope you all are staying safe and doing well as the semester is, I think, coming to an end for you guys, right, around Thanksgiving. So I'm a Georgetown grad. Obviously, I graduated in 2015. I graduated from the college with a major in biology and a minor in STIA global health. And after I graduated, I took 4 gap years, which is a lot. And I like to joke that I've done every single typical pre-med gap year experience that's like possible. I did research for 2 years at NIH, and then I was a medical assistant for a year, and then a scribe for a year. And while I was doing all that, I was also writing as a volunteer EMT in my spare time. So basically, I feel like those are the big 4 that pre-meds usually gravitate towards, and I did them all. So I'm always happy to talk about my experiences with each of them. In terms of what made me decide to take a gap year, I knew from fairly early on that I wanted to take at least 1 year before medical school because for me, it was more so that I wanted to take the time to study for the MCAT outside of school. That was a really big point for me. I just didn't feel like I had the bandwidth during junior or senior year or even during the summer to study for it, as I was also working full time in the summers. I know that most people take it the summer before senior year, but that for me, it just didn't seem like I would have the time to really dedicate towards MCAT studying while I was an undergrad. So for me, that was a big part of my decision to take a gap year. But I ended up really enjoying my gap year when I took it, and it really helped me recharge from undergrad. You guys are all pre-med or considering pre-med, so you know that the undergrad workload is pretty stressful, and I think that taking a gap year and a couple of gap years really helped me be in a good mental state for when I came to med school and was met with the workload at medical school. So I really do recommend that people who are considering taking gap year, like, do at least one. That's my personal opinion. Obviously, it's a choice that all of you have to make for yourself, but I think it's really awesome to at least take 1 year and like kind of rest and recharge before you dive into the rigors of medical school. Obviously, I took a lot more than 1 gap year, so that was not exactly planned. I thought I would take 1 or 2 and then apply. While I was doing research at NIH, I decided that I wasn't sure if I actually wanted to apply to medical school. I enjoyed research so much that I was considering just applying for PhD programs at the time. And so after I finished my time at NIH, I decided to go back to doing some more patient care centered work. And that's when I was looking for a medical assistant job because I wanted to really figure out, like, is med school the right path for me? Is doing my PhD in biology the right path for me? And I was also considering doing a master's of public health was something else that was on my radar in terms of grad school. I did end up obviously applying to medical school, and I'm a second year at University of Maryland now, but I'm actually in the MD MPH program. So I will be getting my master's of public health after either this year or 3rd year of medical school. I still have to decide when I'm going to take my MPH gap year. So I was kind of able to do 2 of the things that I really wanted to do. In terms of talking a little bit more about the experiences themselves, so my first 2 years I did at NIH, working in cancer immunotherapy research at the National Cancer Institute. For me, this was pretty streamlined as I had worked at NIH all through undergrad in the summers. And I also, during senior year, I did my senior thesis through a lab at NIH. So when I was originally planning to take only 1 or 2 gap years, I thought it would dovetail nicely into the NIH post-bac program, which is 1 or 2 years, depending on how long you want to stay with NIH. So I just continued to work at the lab that I had done my senior thesis with. So that was pretty seamless there. In terms of actually securing that experience, I had to transition labs the summer of junior year. That's when I started looking for a new lab to work in, and that honestly involves a lot of like cold emailing PIs. NIH, as I'm sure anybody who has applied to work there, can be pretty competitive if you just submit your application to the general applicant pool. So sometimes it can take either knowing somebody or making direct contacts with PIs to secure your spot there. Or what's also helpful is having a specific research interest. So I was specifically looking for something in immunology and immunotherapy, And that's what sort of really helped me make that connection, is that the lab was really looking for somebody who had a strong immunology background to do research. So people who are interested in NIH specifically and getting positions there, I'm happy to answer more questions about that if you have specific ones, or talk offline, about that process, because I know navigating the NIH process can be a little bit daunting for people who haven't done it before. And I was lucky enough to grow up in Bethesda, so I kind of grew up in and around NIH and have been working there since high school. I started the summer after my senior year in high school at NIH. In terms of my day-to-day responsibilities doing research, it was bench science, but that did translational clinical research. So I was pretty much just doing what you would typically do in a bench science lab. So doing a lot of PCR, a lot of gels, doing a lot of background research, and then towards the end doing some poster presentations and writing up and proofreading some manuscripts that were coming out of my lab. So pretty typical for your research experience. And like I said before, I spent 2 years there, and that's the maximum you can do as NIH postbac. And that was the point where I was trying to figure out whether I wanted to get my PhD, or whether I wanted to go to medical school, or whether I wanted to do an MD PhD or MD MPH. So at that point, I decided I wanted to go back to doing something clinical. It had been a while since I had some patient interaction. I was a member of GERMS, Georgetown EMS, all through Georgetown, but I took about a year and a half hiatus after I graduated before I started volunteering with a local EMS company in Bethesda. So I hadn't really had any direct patient care or patient contact for about a year and a half after graduating from Georgetown. So when I left NIH, I really wanted to get back into some sort of patient care centered field, and I just started applying for medical assistant jobs. So the reason I chose to do a medical assistant job versus a scribe job first is I had heard some just like pretty bad things about scribing from other people who had experiences with some of like the big scribe companies, Scribe America and others. I had heard that those experiences were pretty variable and some people didn't really enjoy them. So I decided that I would just go the medical assistant route as something that would hopefully be a little more stable and have a little bit more structure. In terms of applying for medical assistant jobs, it was kind of like regular job hunting. I just applied for a ton. I pretty much applied to everything that was sent out on the pre-med listserv, as well as just applying for, things off of Indeed and LinkedIn. So I probably applied to about 40 or 50 positions. So kind of, again, like regular job hunting. And I eventually got an interview with a dermatology clinic in DC and was hired there as a medical assistant. The one thing about working as a medical assistant is some locations, and specifically hospital systems, require you to have a certificate in medical assistant training if you want to work with them. So, and that's like a 1-year course where you become like officially certified as a medical assistant. I didn't do that. So that closed off really a lot of like the big corporations, the big hospitals, because they're all looking for people who are certified. So I was pretty much applying to a lot of like privately owned practices because they're the ones that will usually just hire people with some sort of patient care background to be medical assistants. So for me, that was my EMT and EMT license background. So that is really what I felt made me competitive for those jobs. So I did about a year at the dermatology clinic, and in terms of my day-to-day there, basically I was in charge of doing patient intake. So, I would situate the patient in the room, figure out why they were there, get an update on their medical history, and then I would see the patient with the provider, and I would take all the notes for the provider, so basically acting as a scribe as well. And then I would also assist in doing any procedures in the practice. So I would assist with doing skin biopsies, doing minor surgeries, and doing cosmetic work as well, Botox fillers, things like that. So it was very interesting. I learned a ton about dermatology. I also learned that dermatology is probably not a field that I want to go into. So it was really valuable in terms of just getting experience with a different type of healthcare than I was used to. I'd never really been in a private practice setting. And I never really seen how private practice healthcare functions. And I did enjoy my time there, but like I said, I realized that dermatology was like not my calling. So I spent about a year there, and for me, the natural endpoint there came when I left in about, I want to say April of the year that I decided to apply to medical school. So I left to just work on my medical school applications. I did that about full time for about 2 months. So it's definitely not required to take 2 months off to do your medical school applications, but I figured for me, if I was going to do it, and if I had the time and the ability to do so, I might as well take that time and just like fully commit to doing all my applications as thoroughly as possible. And in a short amount of time as possible, I can talk more about the medical school application process if you have questions. But the really big time chunk there is that after you submit your primary application, every school will send you an individual secondary application with specific questions from that school, and that you have to turn around that secondary application usually within like 2 to 3 weeks of receiving it. So as you can imagine, depending on how many schools you apply to, you'll be filling out between like 50 and 20 secondary applications when they send those to you. And they usually send those to you all within a week or two. So a lot of essay writing in a short amount of time. And I was at that time really spending like 6 or 7 hours a day just like writing essays, and I did that for about like 2 weeks. So it's definitely something you can do with a full-time job, but it would for sure be stressful. But I know that a lot of other people do manage it, and I think all the more power to them for doing a full-time job or full-time studies while doing all of that. For me, I felt like if I was going to do it, I would dedicate the time to do it. So I did all my applications, and then after that, I knew I would have, 1 year while I was on the interview trail and all of that. So I knew I wanted to get another job. And so since I had been a medical assistant, this time I figured I would try scribing. The reason I chose to scribe instead of being a medical assistant, again, with either the same place I was working at or a different place, was that I wanted really more of a variety of medicine and patients. So a lot of medical assistant jobs that are open to people without a medical assistant's license, like I said, are in these like smaller private practices that are very specialized in terms of the type of medicine they practice, whether it's dermatology or orthopedics. I think those are the two big ones that I know that I applied for. Some ophthalmology clinics as well, but they all are usually very specialized in the type of medicine they apply. And since I did not know what type of medicine I wanted to go into, I wanted to do something with sort of a more broad overreach in terms of patient care and medicine. So I applied to be a scribe, and I eventually was accepted at a scribe position with Scribe America at Suburban Hospital, which is in Bethesda. And I was working with the inpatient hospitalist team. So basically, I was working with the internal medicine team that admits patients to the hospital from the emergency department. So I wasn't seeing patients right when they were brought into the emergency department, but basically seeing the patients that were deemed sick enough to be admitted to the hospital for an overnight stay or longer, depending on whatever their chief complaint was. So I was with the internal medicine doctors who were doing that. I really loved scribing. I know, like I said, that some people have really variable experiences with some of the big scribe companies. I was lucky enough to be at a site where the scribe leadership was very responsive and very competent. And I know that that's not always the case for students. And I know that can be a barrier for a lot of people who are thinking about scribing. But like I said, I had a really great experience and I learned a lot. So for those of you who don't know what scribing is, I'm sure you all do, but basically what I would do for every patient is we would get patients who are going to be admitted to the hospital. I would do a chart review of the patient. I would go through their entire medical history, as well as all their recent admission paperwork, like their lab work, their imaging, all of that. I would then prepare an outline of an history and physical note, an admission note. So I would, and basically prep all of that for the provider. And then I would go with the provider to actually see the patient. The provider would do their interview and physical exam, and I would take notes while the provider was doing that. And then we would go back to the call room, and I would basically write the full note for the provider, including the history, the physical exam, and I would also do the assessment and plan in a bare bones of like what, from my experience and what I thought the provider would want for the assessment and plan. And then the provider would take over the note and make any changes that they would want. In terms of experiences that really set me up for medical school, this was really major. So as a scribe, I learned how to do a proper H&P note, which is like what they spend all of first year of medical school teaching you how to do. So I went into medical school already knowing how to do that type of note. And so that was really valuable. And I already knew how to, basically take a detailed history and write a good assessment and plan and all of that. So that was very valuable for me in terms of my scribe experience. Do you need some sort of certification to be a scribe? You do not, at least for any of the big scribe companies. Like if you go through Scribe America or through one of those, you don't have to have any certification. How it works for that application, like I can speak for Scribe America specifically because that's what I went through, is you apply sort of through like the general Scribe America website, and you indicate sort of the regions that you're looking to work in. And then what happens though is you'll usually have to wait a bit, because what happens is each hospital kind of, and each head scribe chooses applications out of that portal when they have openings. So like I was contacted directly by the person working at Suburban who was in charge of the scribes, and they had pulled my application out of the portal and interviewed me for that position. So there can be a bit of a lag time in terms of when you submit your application and when you start being contacted for interviews. So that is something to keep in mind. I think from the time that I submitted my application to when I actually started working was about a month and a half. So that can be something to keep in mind. It's not like an immediate like 1 to 2 week turnaround. So just something to keep in mind as a buffer if you're thinking of applying for that. Oh, awesome. Scribe America has the info session tomorrow and Thursday. Oh, yeah. So as you can see, there can definitely be a backlog, and I'm sure obviously things have really changed probably pretty dramatically with COVID in terms of which sites are allowing scribes, the number of scribes they're allowing. So obviously that wasn't a consideration when I applied. So I'm sure that that will affect things as well. Training preparation process. So like, again, I can speak specifically for Scribe America. For that, there were like a bunch of videos I had to watch, and there was a big booklet of things I had to memorize, and then a test I had to take. So it's nothing too arduous, especially for you guys who are pre-meds and who've been through, like biochem and orgo, but probably the most daunting thing I had to memorize like the 100 most commonly prescribed medications. That was probably the like most esoteric thing that I had to memorize. And that's just so you have like good familiarity when you're looking through a patient's medical records. So like if you see if they're taking lisinopril, you know that's a hypertension medication, and that's probably what they're taking it for. And again, that was actually something that's become really helpful for me in medical school, because I already have that good foundation. So like I can already look at some of the medications that we're learning and be like, oh, I kind of already know what this is. Can you talk more about how you got the MA position without the certificate 1-year course? Yes, so again, like I said, I really looked for job listings that didn't require that. So they'll usually say in the job listing for medical assistant whether or not they're looking for specific qualifications. So when I was basically looking online, I would just immediately rule out anything that required the certification. And like I said, for most of these smaller private practices, they're really just looking for somebody that has usually some sort of experience in healthcare, and they're usually really happy to take pre-med students too, because they know that you guys are dedicated and want to do this as a career. And like I said, I know that the pre-health listserv also advertises a lot of positions, and I applied through those as well and actually interviewed for one of them, which was coincidentally also at a dermatology office, just a different one from the one I ended up working at. Any reason you didn't look at becoming an ER tech? So I actually did apply to a bunch of ER tech jobs. This was about the time when I was applying to MA jobs, and I just wasn't able to find a ton of postings in the area. I applied to ER tech jobs at some of the bigger hospitals, and I just never heard anything back. So I think I would have been really happy being an ER tech because I am an EMT, but I think I only applied to about 4 of those jobs because there weren't too many at the time that I was looking. And I didn't end up getting called in or contacted about any of them. And yeah, so I guess the one final thing I haven't talked about is being an EMT. So that isn't a job for me. That's something I do for fun because I enjoy it. I was an EMT with germs when I was at Georgetown. So shout out to anybody in the chat who's also on germs. I'm really sorry you guys aren't on campus and can't actually be there to provide the healthcare and service that you guys love doing. Like I said, I took about a 1.5 year break from being an EMT after I graduated, but then I applied to be an EMT with my local EMS squad with Montgomery County Fire and Rescue. So with Glen Echo, which is near where I grew up in Bethesda, Maryland. And then I've been with them for about 3 years now, 4, not sure. So I rode with them obviously full time before I came to medical school. And now that I'm in medical school, I have been riding with them when I go home on break. So I rode this past summer when I was in the break between first and second year, and I'll ride if I go home for like Thanksgiving or Christmas. So in terms of what being an EMT really prepared me for, it like really taught me how to talk to patients, which is again something they spend a lot of time teaching you in first and second year, is like how to do a good patient history and what kinds of questions to ask patients. And for me, that all came pretty easily from years of doing it as an EMT. So that's just something I think that's really valuable in terms of getting good patient care experience. And I really love doing it. So that's mostly why I did it. Right, and let me look at the other questions here. I think I talked about how the experience set me up for my application to medical school. In terms of which gap year set me up for success, I would say probably the top 2 ones that were most instrumental for actually like succeeding in medical school currently would probably be being a scribe and being an EMT. I think those have the most skills that directly translate to medical school skills. The other 2 were very valuable for other reasons. Obviously, doing research looks great on an application, and I was able to get a couple of publications and poster presentations out of that. So again, useful for applying, but the skills, obviously, you don't need to know how to run a PCR and gel to go to medical school. So those specific skills don't necessarily translate 100%, but I still do really enjoy research. And being a medical assistant, since it was so specialized that I was doing, I was really very, very dermatology focused. A lot of the skills like talking to patients and working with providers and having good teamwork and interpersonal communication obviously translate, but like a lot of the very derm specific knowledge that I gained is something that I probably won't really ever use because I'm not planning to do a dermatology rotation while I'm in medical school. All right, what is the timeline for applying to the post-bac program at NIH? I am not 100% sure if I remember it exactly, but I think the application goes live sometime now in the fall and that you're supposed to submit it. I want to say the due date is sometime in January, February, if you're thinking of starting in the upcoming summer, you know, if you're a senior and thinking of starting it when you graduate. So I think that, yeah, you have to submit it by January, February, the application. And then obviously you're then in, waiting to hear from labs or reaching out to labs yourself and trying to set something up. What were you asked most about in interviews of those positions? I think I was probably most asked about like, why would I be successful in that position? And for me, that's where having my history as an EMT really came in handy, specifically when I was applying for my medical assistant and scribe positions. I think those were both, that was something that was really highlighted in both the interviews that I had, was that I already had a pretty strong foundation in patient care, and as well as like talking to patients, as well as just like a generally strong like medical terminology background and things like that. So those were all things that were brought up in my interview. All right, do you pick your rotations in medical school? I thought you had to do every area. So yes. So how it works is during third year, you do your core rotations. So those are rotations in internal medicine, surgery, pediatrics, psych, and a couple others. Oh, OBGYN, and one or two others. Emergency medicine, maybe. I'm in second year yet, so as you can see, I have not quite gotten to that point. And then you have then space for elective rotations, and that's where if you're looking into going into a specific field like dermatology or radiology, otolaryngology, then you then make the conscious effort to select those as your sort of as your special rotations that you do. You'll get some exposure to everything, but you won't have a concerted rotation into it. So like during your internal medicine rotation, you'll rotate for like a week on gastroenterology, a week on pulmonology and all of those. But if you want a specific rotation in one of the subspecialties, then you need to use one of your elective spaces for that. Oh yeah, submission item put in here that you apply 6 to 9 months before the date. So like I said, if you're looking to do NIH this summer, I would recommend starting to think about that process right now. Like just start thinking about your application, getting letters of recommendation, thinking about which labs you want to apply to, things like that. And again, I'm happy to talk offline more specifically about that. I'll put my email and all my contact info in the chat at the end of this if you have specific questions about your application to NIH and all of that. Okay, sorry to clarify, medical school interviews, were any of your experiences brought up more frequently than others? I don't think that any of them were brought up more than others. Most interviewers commented on the fact they had so many gap year experiences, and they just generally asked me what I thought I gained from each of them and how they impacted my application. And it was something that I talked about on my interview trail as well, the fact that some of my experiences really helped solidify for me that med school was the right path versus just doing a PhD or just doing an MPH. I think probably the one that some faculty most enjoyed talking about was probably being an EMT. And, I would get comments about, if you're an EMT, like what a critically ill patient looks like. And that's like the first thing that you need to know in medicine is like, is your patient going to die in the next, 10 minutes or are they not? So I remember that striking me on their interview trail. But I don't think there was any one of my interviews experiences particularly that made me, I guess, stand out more than others. And every interview I was in also asked about my research. So I think that's something pretty standard that if you do research, they'll probably ask you at least one question about it. All right. When applying to MA programs, did you have some sense of what you want and didn't want to specialize in? Would you recommend choosing a program accordingly, or is it tough to have any position as an MA? So yeah, so when I was applying to MA programs, I really did not have an opinion on what type of office I wanted to be in. I wasn't sure what type of doctor I wanted to be. I wasn't sure if I wanted to be a doctor at that point. So I was really okay with being in any field. I think the advice that I would give to you guys is if you're passionate about a field or really not passionate about a field is to avoid applying to an MA program in that area or look for an MA program in that specific focus. I think one of the main differences between my job as a medical assistant, my job as a scribe, was really, like I said, the scope of medicine and patient cases that I got to see. Obviously, when I was doing dermatology, I only saw derm-focused cases, and I only saw derm-focused cases in an outpatient private practice. So, you know, things that were basically like the bread and butter of dermatology, nothing super weird, nothing super exciting, just kind of like the regular stuff you get at a derm clinic. Whereas being a scribe for internal medicine at a hospital, I saw like literally every single chief complaint that you can think of, including some like pretty rare stuff that I wouldn't have ever seen either as an EMT or as a medical assistant. So it really depends on you and what kind of experience you're looking for. Like I said, a lot of the MA jobs that don't require certification are in these smaller private practice settings. So they might be more specialized with the type of medicine they're applied to. Could you talk more about what applying to the MD MPH program was like? Sure. So that's pretty easy. I would say 70% of medical schools, or at least that's my experience, have an MD MPH option. Some schools let you apply to the MDH option right away, like when you're just applying to medical school, they'll let you opt in to apply to the MD MPH program. Some schools will admit you as an MD first and then allow you to apply for the MPH year once you're already a medical student. I applied to 16 schools, and I applied to 15 schools that had an MPH program. I think there was only one school that I applied to that didn't. For most schools, the MPH application usually just involves an additional essay or 2 or 3 signifying like why you want to do the MPH program. It's really not arduous. There's like no extra letters of recommendation or anything like that. You really just need to show a demonstrated interest in pursuing that path. I did have a letter of recommendation from one of my public health teachers at Georgetown, but that was just one of my general letters of rec. So I'm not sure though if that influenced my application one way or the other. What was your work-life balance like during your gap years, and what is it like now in medical school? My work-life balance during my gap years was pretty great, except for when I was studying for the MCAT. So I did work full-time and study for the MCAT at the same time. I thought that, for me personally, I thought that was better than studying for class and studying for the MCAT. I don't know if it actually was better. I mean, I scored fine on the MCAT and gone to medical school, so I guess it worked out okay. But once I finished studying for the MCAT, I was just basically working a normal job. My laboratory job and my medical assistant job were both 9 to 5. Something I should have maybe mentioned before, my scribe job had pretty variable hours. So that's something to keep in mind if you're scribing in like an emergency department or with internal medicine that works out of the emergency department, is that's a lot of shift work. So my schedule was set by the month, and I could be working either the day shift, the afternoon shift, or the night shift. So each shift was 8 hours, but like I said, it was either the day, the afternoon, or the night shift. So there were some, obviously some nights where I was working like 5 p.m. to 3 a.m. So if you're really not like a person who enjoys working at night, that's something to consider. I really like the night shift. I enjoy working at night. Maybe it's part of being an EMT, is I'm like used to getting up in the middle of the night and being up. So that was not a downside for me personally. But otherwise, outside of my job, I was volunteering as an EMT, but otherwise pretty good work-life balance in medical school. I definitely have a lot less time for fun things than I did before, but it's definitely not as overwhelming as it could be. I would say right now I put in maybe about 8 to 10 hours a day studying, and then I have time left over. So I am of the philosophy of like treating medical school like a full-time job. So like I put in like a 40 to 50 hour work week as my studying is kind of how it works. So And I mean, I think it's definitely possible to have work-life balance in medical school. It's just harder. All right. Can you share what students can expect for a rough salary during these gap year experiences if you feel comfortable? Yes. Oh yeah. So this is definitely something that can be a barrier to a lot of people, is the salary. It is definitely not a lot. I would say through my time both at NIH as a medical assistant and as a scribe, I would say I was averaging between like $30,000 to like $37,000 like as a yearly salary. With scribing, it worked out a little differently because, like I said, it was shift work and my schedule was month by month, so that was a little bit more variable. But I think I was being paid whatever minimum wage was in DC, which I can't quite remember. So you are definitely not making a lot of money. I was lucky enough that I was able to live at home during those years. So I didn't have to pay rent those years. So I was able to actually pretty much save all of that money and use it for now when I'm at medical school. So that definitely worked out well for me, but the salaries for these gap year positions aren't a lot. So that can be a stumbling block for a lot of people. And you're definitely not going to be making as much as probably a lot of your friends who have graduated and are moving on to, their full-time careers are making. What is the difference between MD and MPH? So MPH is just a master's in public health. So if you apply for just your regular MD degree, that's just 4 years. And you graduate with your doctoral degree. If you apply for the MD MPH, it's 5 years, and basically you add in a year of public health classes, either after your second or third year of medical school. And then you graduate with both your doctoral degree and your master's in public health. It's pretty similar to the MD PhD model, just that it's obviously a master's in public health is shorter than a PhD. So if you do the MD PhD route, then you do 2 years of medical school, 3 to 4 years of your research PhD, and then your last 2 years of medical school after that. And the reason it's split up that way is most medical schools, the first 2 years are all preclinical work. So basically it's all book learning, and then your third and fourth year are your clinical rotations. So for most people, the natural gap in medical school is between your second and third years. That's when you have the time to do other stuff. Do you feel that being a bit older than most of your peers in medical school due to taking several gap years has any advantages or drawbacks? I'm actually not that much older than most of my peers. So University of Maryland showed us the stats, and I think 70% of the admitted class, 60 to 70% of the admitted class have taken at least one gap year. I am on the older end, but I think there's about 20, 30 students that are older than I am who are doing this as like a second career. So like I said, only about 30 to 40% of our class went straight through from undergrad. And I think it's becoming much more common to take a gap year or two now before going to medical school. The advantage is that I think having a gap year really helps bulk up your application, and it helps you stand out in your application. And also, you can study for the MCAT, you have more time to do your applications. The drawbacks is that obviously medical school is a long process. So medical school itself is 4 years, during which you're not making any money. And then afterwards you have residency. So depending on which field you're going into, your residency can be anywhere from 3 to 6 years, during which you're also not making a ton of money as a resident. You're making between, I would say, $50,000 and $70,000 a year. And then after that, some people do a fellowship, which is another year or two after your residency. So if you choose a long track of what you want to study, like if you choose neurosurgery, for example, which I think is like 7 years and a fellowship, is that you won't be making attending level salary until, until 11 or 12 years after starting medical school. So that is something to consider if you're going down a route that it has a potentially very long training period after medical school. So something to keep in the back of your mind. What did you do to stay in touch with professors who you might want letters of rec from the medical school during a gap year? So I knew that I was going to take a gap year before I graduated, so I locked in all my recommenders before I left Georgetown. I told them what I was planning to do for my gap year, and I said that they were welcome to, write a letter or write the outlines of a letter now, and I let them know that I would be contacting them in a year or two to get that letter. Obviously, when I decided to take more gap years, I didn't contact them for the letter, but I contacted them, letting them know that I was taking another gap year. So I didn't run into any problems with my letters. It did help that I think that all my recommenders were people that I had fairly close relationships to at Georgetown. They were professors that I had either taken multiple classes with, or one that served as my thesis advisor. So I didn't have really any trouble with the years that passed. When I did ask for my letters, I sent them basically everything. I sent them my resume, I sent them my personal statement, and I sent them just kind of like a brief background of like, oh, I'm applying to medical school and like what I got from their class. And I also sent them like a piece of work that I completed for their class that I did well on, just in case they had like forgotten who I was, and a picture. But I did not have any trouble having them like write letters for me. Why did you choose MD MPH as opposed to MD PhD or just MD? Great question. So for me, I really thought very seriously about MD PhD, but by the time I was applying to medical school, like I said, it had been 4 years out. And for me, I was thinking about time as a factor. And I wasn't sure that I wanted to spend at that point 7 to 8 years in medical school, which is what an MD PhD program is. I didn't think that I wanted to at that point be in school for that long. But I had always loved public health. I did my minor in public health at Georgetown. So when MD MPH was an option, I knew that it was something I wanted to pursue. I really enjoy looking at medicine from a bit of a different angle than just like the strict basic sciences. I think really like a social understanding of health is pivotal as our role as physicians in the community. So I knew for me getting that component in my education was important and something I wanted to pursue and prioritize. Do you need a certificate to volunteer at GERMS? So you need to be a licensed EMT. So I know the GERMS normally, when we're in campus, offers an EMT class every semester. However, there are EMT classes all over the nation. So a lot of community colleges have them. A lot of your local fire and EMS squads will have them that are open to the public. It's usually a 2 to 3 month long course to become certified as an EMT. And it's kind of like a regular class. I would say it's about like 10 to 12 hours of classwork a week, including tests. And then at the end, you take both a written test and a practical test. And then you have your EMT license. So this is usually to get a national EMT license. And then depending on where you want to work, you might have to get additional certifications at a state level. So I have my national EMT license, but when I transitioned over to being an EMT in Maryland, I just had to take an extra weekend long course and exam to become certified in Maryland, just because every state has a bit of a different medical protocols. So you just need to get familiar with some of those state level protocols if you have your national EMT license. Did you feel like you needed a break from being a student between being an undergrad and a medical student? I definitely did by the time I finished at Georgetown. I really did feel like I was pretty burned out by the time I got to my end of undergrad. And I felt that having at least a year where I wasn't studying all the time was something that would be beneficial to me. And it really was, looking back, medical school, like I said, is really a full-time job. I study twice as hard in medical school as I ever did in undergrad. So for me, I think I would have been really, really burnt out if I'd gone straight through. Obviously, it's very doable. People do it all the time, but just for me personally, I don't think it was the right choice. So it's just something for you, all you juniors and seniors, if you are feeling really burned out, maybe consider taking one gap year before heading to medical school, because it really is nice to recharge for a year or two before you dive back into studying full time. Oh, somebody posted the Georgetown EMS link in the chat. Awesome. Can you do DO MPH? Have you seen any negative difference between being a DO or an MD? So I'm actually not a great person to talk to about this because I did not apply to any DO programs and I didn't really explore that route for myself. So I'm actually not sure if DO offers an MPH route. In terms of the difference between being a DO and MD, again, I can't speak too much about this. But I think with being a DO, there's no difference at the end of your training. If you're a DO, you're a doctor, just like an MD is. At the end of your training, you have the same certifications and the same skill set. I think the only real difference is how you get there in terms of the DO school versus MD school and the types of classes and things like that. But I don't have a great handle on what on the DO education, because like I said, I never really considered that route for myself. Feel free to drop any other questions in the chat, but there's 2 more questions from the pre-sent list that I can try to answer. Nothing that'll take too long. One of which was, what has been your biggest surprise on becoming a medical student? I think that the biggest surprise for me really was the workload and also the test frequency. So I have an exam every 3 weeks, at least that's how University of Maryland works. And it really, the medical school curriculum, there's really no leeway for you to fall behind. So everybody uses like the fire hose analogy. It's like that going to medical school is like trying to drink from a fire hose. And it's pretty accurate, I would say. It is pretty difficult in terms of just the sheer amount of stuff you have to memorize, but definitely doable. And the other thing was, I was surprised about how prepared I felt for the patient care and interaction part of medical school. I really felt like when I started doing my clinical experiences in first and second year that I felt very comfortable with what was being asked of me. And I think my gap years were really instrumental in that and like making me feel comfortable talking to and interviewing patients and doing the physical exam on patients as well, because those were all things that I had practiced doing as either a scribe, a medical assistant, or EMT. And then in terms of how has COVID impacted your medical school experience? So it has definitely impacted my medical school experience, but as a first year when COVID first started, as a second year now, I'm probably in the ideal position out of any of the 4 years of medical school. So like I said, the first 2 years of medical school is your preclinical time. So you're primarily doing book learning. And so that translated to being online pretty well. How my schedule works is I have small group for 2 hours from 8 a.m. to 10 a.m. every day. And then I have lecture from 10 p.m. to 12 p.m. And then I usually have once a week some sort of clinical learning experience. So lecture and small group all translated to being on Zoom pretty well. When COVID first hit in March, they put a stop to all our clinical rotations at that time. And then we broke for the summer. But when we came back in the fall, they had made plans for us to be able to do our clinical rotations despite COVID. So we only see patients who are confirmed COVID negative in the hospital. So we see patients who are inpatient who've already been tested and confirmed COVID negative, and we obviously see them in full PPE. So my experience as a first and second year student hasn't been too impacted by COVID. They adapted pretty well at University of Maryland. I think it's very different for first, third, and fourth years, because third and fourth years obviously had their rotations really impacted while they were in the hospital, because for a while all rotations shut down permanently. And first years obviously had to start medical school online, which isn't ideal, and aren't able to do anatomy lab, which I was able to complete as a first year before COVID happened. So as a second year, I felt pretty lucky to be in the situation I was when COVID happened.